Good morning, everyone. Welcome to the Spring Transportation Advisory Committee meeting. I am Sharon Pearson. Thank you, everyone, for attending this quarterly meeting. This is a meeting that is required through the Ohio Department of Transportation for mobility managers to hold because it is important that we get input from the community on the transportation needs here in Lorain County. And so this is not my transportation plan. This is our transportation plan together as we focus to improve transportation options specifically targeted or specifically for segmented populations that include low income seniors, people with disabilities, and also workforce, and anybody else who would like, but those four categories are the ones that we mainly focus on. So I'm going to start sharing my screen just so that you can see. So today is Thursday, March 17th. Happy St. Patty's Day to everyone. I don't have green on, but I made sure to put green on the screen. So hold on just 1 minute. I'm operating off of two screens. And so you do see the next screen. Okay, so I just wanted to go over what the agenda looks like today. We're going to first have a presentation by Mike Hibbard. Many of you may be very familiar with him when he was with a different organization, but we're going to talk about his new organization today. Then we're going to ask you to pull out your phones. This is something that those of you who've been on the call before have seen me do. I like to do some engaging work because we're on Zoom and a lot of times we're just sitting there. We're not really engaging, but it's really good to get some feedback from you on some questions I have around transportation. Really helps me to plan based on a lot of the answers that you provide. Then we're going to be talking, just to remind you of the objectives that the Lorain County Mobility Management Program has. Then we're going to be looking at the transportation guide. It's a guide that we put out about it's probably been about 8 months ago, which has been very popular. But we have some needs to make some improvements to it, and I would love to have your feedback on that. And then last, we're going to be talking about the 2023 Lorain County Mobility Management goals. Yes. It's barely 2022 and we're already talking about 2023. That's the way Ohio Department of Transportation rolls these days. As soon as the 1 year starts, we're already starting to think about the next year. But we need your input because we turned in a letter of intent. And now that we have been invited to apply for the grant, but it would be great to hear what are some of the specific needs so that we can develop a narrative around the goals that we've established. So first, we're going to start off this meeting with hearing from Mike Hibbard. It's with AmeriHealth Caritas. I'm not sure if I'm saying that correctly, Mike, but I'll go ahead and turn it over to you.
Great, thank you, Sharon. I appreciate it, and really is nice to see a lot of familiar faces on the Zoom screens, and I appreciate allow me to take some time to, as Sharon said, introduce you to where I'm at now and what I'm doing. Also have one of my colleagues that is on the line as well, and I'll introduce her as well. Let me go ahead and share the screen here, and I think I can do that. There we go. Just a short presentation. Can you see that introduction to AmeriHealth Caritas, Ohio? Anybody see that? Jamie, you're shaking your head. So, okay, great. So let me give you a little background here. So introduce myself. My name is Mike Hibbard. I am the manager of community outreach for the state of Ohio for AmeriHealth Caritas, Ohio. As Sharon said, many of you probably are familiar with me from my time. Spent about 6.5, almost 7 years with Buckeye Health Plan as a regional representative with a focus, a lot of my focus in Lorain County. And so I've had the great opportunity to explore partnerships, relationships, and really kind of immerse myself in in the county and what's going on. And so at the end of last year, 2022, I was approached by AmeriHealth about joining them as the manager for community outreach for Ohio, and wanting to be able to kind of take that next step. I graciously accepted. And so starting in January, started putting a team together that will be on the ground and out in the communities, as well as myself, being able to build those relationships and get AmeriHealth Caritas's name out there in the communities. So Jamie Clear, who's on the call, is going to be she's going to be taking my place as far as being in the county more as my responsibilities kind of expanded. However, I want everybody to know on the call that by all means, the relationships that I built with many of you are very important to me. And so I don't want you to feel like you cannot reach out to me directly. And Sharon has my contact information. I'm sure we'll share it. But please feel free to reach out to me. Jamie won't feel slighted. I can guarantee that. She'll be okay with that as she gets to know many of you like I did. So Jamie, you want to say a quick hi, and then we'll go ahead and jump into the presentation.
Yeah. So hello, good morning. As Mike said, I'm Jamie Clear. And I will say last night I was out in Elyria doing an event, one of the first events that I've done in a couple of years now since COVID. And I had a lot of good feedback about Mr. Mike Hibbard and how I had big shoes to fill in the county. So, so yeah, I'm really looking forward to being out there. My focus previously was more of the Toledo area, but I have filled in out in Lorain County before, so it's very humbling to be on the team with Mike, because I know he's very well respected in that area. So we're really looking forward to being out there.
Thank you, Jamie. So as I dive into the presentation, and I'm not going to read this word for word, everybody. But what I want to do is just give a quick background. So in case you weren't aware, back in 2020, the state of Ohio rebid the Medicaid contract, okay? At the time, there was 5 plans that served Medicaid members in Ohio, and that bid went out. And then in April of 2021, the state announced the new bid winners. And so there were 4 incumbents that were received contracts, as well as then Anthem, Humana, and AmeriHealth Caritas. Aetna was chosen to manage the Ohio RISE program, which is the more intensive foster children, behavioral health needs of many of the kids. So it affects about 60,000 kids in the state of Ohio. So AmeriHealth Caritas, although we are going to be new to the state of Ohio, we are not new to Medicaid. We have served Medicaid for almost 40 years in the state of Ohio, or I'm sorry, in the country. We were started by a couple nuns in Pennsylvania in a basement. They saw a need of folks being able to receive health care and proper health care. And so from that, AmeriHealth Caritas was born a few years later. Let me go ahead and go through. So this is our mission here. So we help people get care, stay well, and build healthy communities. And our vision with all of that's said there, really this last part here, in order to reach their American dream. So everybody that's in the United States, has their own version of the American dream. And so we want to be able to empower those people to be able to make the decisions and have the ability to reach their American dream, whatever it is, okay? This kind of gives you a little bit of a map here of where we operate. Ohio, being green, is our newest state that we're going to be operating in. We do have plans in Michigan, Pennsylvania, North, South Carolina, Florida, Louisiana, Washington, D.C., New Hampshire, and I believe Delaware is the other county that state we have. We also operate some pharmacy benefit programs in some other states. But really right now our focus is kind of the East Coast. And so we serve roughly about 5 million members. Again, we've been in business about almost 40 years. So again, we're going to be new to Ohio, but we're not new to Medicaid. So it's not like we're building a brand new company here. We have a great team that we're building in Ohio, from our president, Mark Grippy, who has many, many years in managed care, to many of our directors who have come from some of the other managed care plans in the state and around the country. And then right down to our representatives, our team that will be out in the field, such as Jamie. Our big thing that we want to do is we want to create partnerships, but we want to create them in a different way. So we really want to be different from the norm. And how do we be different? Well, I'm going to point to my ears here. This is where we want to be different. We want to listen to what the community is telling us and what the organizations and agencies are saying, and then come alongside of them to be able to either build programs or enhance programs, support programs, instead of us coming in as the big bad managed care plan and saying, hey, we know this business, this is what we think needs to happen. We don't want to do that. We want to work with the organizations and communities on what some of the issues are, and then see what we can do to help out. Had a great meeting last week. Again, just being able to build those relationships with Mayor Whitfield in Elyria. Him and I developed a great relationship with his time at the Urban League. And so we met with the mayor last week, had a great conversation on some of the things that are happening in the city. And, hopefully we can continue to build upon that. But again, it was us listening to what the mayor was telling us, not us going in and suggesting programs that we think might work or doing what we think should be done in Elyria. This is our current model of how we operate. So chronic disease is obviously a large thing. Advocating for change, really using research to determine, what makes sense in healthcare and the benefits we offer, and then supporting that as well. And then, really trying to create, best-in-class programs. We have an organization that's part of AmeriHealth Caritas that is called the Social Determinants of Life. And everybody talks about the social determinants of health, but we know that it's more than just health, right? It's your entire life that is affected by these social determinants. So that's why we branded our program the Social Determinants of Life. And that foundation helps address many of those issues across the membership that we serve. As you can see here, our care, the members are in the middle, right? The health issues, social issues, we want to help address these items so that we can serve our members better. We know that food access, transportation, right? That affects the health of our members, whether it's being able to access healthy food, whether it's being able to reach the doctor's office. We know telemedicine is out there, and we know that it's a big thing. But again, there's a large chunk of people who want to go to the doctor and not be seen by a doctor over the phone. So we know that transportation, and quite frankly, it's probably one of the biggest issues and hardest to tackle. And I'm not telling Sharon anything new here. She knows that. On the side with health issues, so behavioral health, chronic disease, like we talked about, health literacy is another big one that I'm passionate about. I've had the honor for the past 2 years to serve on the board of the Ohio Health Literacy Partners. And it's a great eye-opening experience when we talk about community members being able to feel empowered to ask questions at the doctor's office, right? We all get white coat syndrome, right? We go to the doctor's office and the doctor tells us, hey, this is what is wrong. And we sometimes we then stop. We don't want to ask questions. We don't want to ask anything else because the doctor's telling us. And so we're afraid to do that. But that's another piece of our puzzle for AmeriHealth Caritas, is empowering people to be able to make those decisions that affects their health and well-being. Excuse me. So partnership and collaboration, and this is really where I was able to build a solid foundation in Lorain County and around the state. So who do we want to partner with? What do we want to collaborate on? We don't have a cookie cutter approach. It could be many different things that we can collaborate on, whether it's health education, whether it's those barriers to transportation, the food insecurity. We're working on some great programs around the state with partnering with some organizations to do some different things regarding food insecurity. Emotional fitness and well-being. Again, we're trying to think outside the box and how we can address some of these issues. Community events. I've had the opportunity to do many different community events in Lorain County. And I've always been extremely pleased on the turnout and the organization of events that happen in Lorain County. And when I say I've stood up in meetings in my previous employer and even now with AmeriHealth, and touted some of the ideas and events and things that happen in Lorain County, it's 100% no doubt. There's some great ideas and great things that come out of Lorain County. And so I tried to make sure that others know about that the best I can. So I guess it took kind of wrap that up what I'm saying. If there's ideas that you have for partnership and collaboration, please let us know. Let Jamie know, let I know. We'd love to sit down and talk about it and see what we can do with you. That's it. I don't want to take up a bunch of time, just to kind of give you a quick overview. Before I end or take questions if there are any, we will have brochures and information that we'll get out. We'll start distributing in the county and around the state. Right now they are in ODM's hands, Ohio Department of Medicaid, and until they approve them, we can't distribute them. So, and they are very busy right now with doing readiness reviews with all the plans and approving different items. So it's a little slower process than what we would like, but as soon as we get that information, we'll get it out to you. But that's not going to stop us from collaborating or meeting or those types of things. So if there's any questions, please feel free to let me know. If you think of anything afterward, let Sharon know and she can forward them to me as well. So thank you again. I appreciate everybody's time for allowing me to introduce AmeriHealth Caritas to you all.
All right. Thank you, Mike. So does anybody have any questions for Mike? You can go ahead and unmute yourself and ask.
I don't have a question, but I did want to let you know, I just popped in my email and cell phone number for you all to have to keep on file for me. So I look forward to working with you all.
Okay. All right. Well, if there is nothing else right now, as Mike said, you can go ahead and send me any of the questions and I can, or ask me for his contact information. I can make sure to get that over to you. So we're going to go ahead and go back to our presentation, pick up from there. So now it's engagement time. So either if you could pull out your phone and type in Menti, MENTI.com, or just reduce your screen and type in Menti.com into your computer. Then you go to the code 3305-5002. That's the code that it's going to need in order for you to participate. You don't have to participate if you don't want to. This is just something fun that I like to do with the meeting to gather some input. I have to reshare my screen again because I want to, so that everybody can see some of the results here. So let me reshare a new screen. Hold on just 1 minute as I try to figure out how to do this. I went down to one screen instead of sharing two. So hold on just 1 minute. Let me get up the other screen. I cannot minimize when I'm recording. All right, let me just bear with me 1 minute. I need to bring up my other screen again. And this is not letting me reduce. All right, let me do it this way. All right, there it goes. It is so weird trying to work with two different screens. All right, I think I finally got it. All right, are you seeing the LoraineCounty.com mobility management? All right. So if you put in, type in menti.com, type in the code 3305-5002, and then we'll move on to the first question. I can get my, okay, there we go. So which group best represents the clients you serve or who you serve? Or do you represent any one of these groups? Let's see who we have here. So we have a lot of low income represented, disabled, followed by, well, seniors, disabled, but mostly representing low income and disabled. All right, let's go on to the next question. Have you ever been on Lorain County Transit? Have you ever ridden Lorain County Transit before? Majority of people, no. There's a few people who have. I just want to let you know in May, there's going to be an opportunity, if you've never been on Lorain County Transit, to ride with me the whole month of May. You can just, it's a 2 hour, it's going to take you 2 hours out of your day. Better schedule 3. But I invite you to come with me so you can experience what it's like to ride our transit system here in Lorain County. Next question. What access is the greatest need for your clients or people that you know? Do they need access to food and groceries? Is it medical, work, job, crossing county lines, or social events, visiting friends and family? And I believe you can answer more than one. You can't, oh, it's only saying one. Okay, so I'm asking for what the greatest need is. So medical is winning out right now with work and job. Well, work and job are starting to be even right now, which is very interesting because like 4 years ago, access to work and job did not really show up. And now since the pandemic, it's starting to show up more and more. So this is really good information to be able to get from everybody. Okay, next. Where are your clients located? Are they mostly in rural? Are they mostly in urban? Or are they really kind of like in both? I just want to understand this because our transit system is mostly in our urban centers, but Lorain County is mostly rural. So it's very good for us to know and understand, you know, how, if there is a strong need in the rural communities, how do we begin to think about how we access or provide that type of transportation? So we're mostly seeing from people saying both. So that's really, really good to know because I feel as though because I'm in the urban center, that's where I'm focused, but there's a strong need to reach out to the rural. So we do have one person that says mostly rural. Next question. Oops, I forgot to put a question here. So skip that one. If using transportation across county lines, which county do your clients need access to? Is it Cuyahoga County, Erie, Ashland, Medina, Wayne, Stark, Summit? Looks like Cuyahoga County is winning out, which is what we've really been seeing from a lot of our transportation surveys. But Huron has been a very close second. So this really corresponds with the information that we've been receiving. So I believe that this is the last question. So I think you can answer multiple times on this, but what is one improvement regarding transportation that you would like to see happen by the end of 2023? And I'm asking this question so that it really gives us some input into some of the goals and the narrative for the 2023 grant for mobility management. I don't know if it's getting the word out about more options, if it's more connectivity between rural and urban centers, if it's adding technology so that it makes it easier for people to either pay using, even for unbanked people, using just not credit cards, but reloadable cards like a Dollar Tree, Dollar General. Is it being able to see the maps online? Is it some expanded routes? Is it, you know, accessibility to places of need? I know Mr. Jones and I were talking about not only access to medical or access to job or job training, but also care for their children, childcare. So, you know, anything that you can think about, because this is really gonna help us with setting the tone for our focus between this year and next year. So accessibility, more routes, options. What I'm understanding is that people would like to see more transportation options. We're seeing technology expanded. So when the words come up bigger, that means a lot more people are saying or agreeing with that word. So accessibility, more routes and options, routes to industrial park, access to transportation, loops, improved technology, expanded, one place to find options. So this is all good information. Some of these things we're working on, so that's good. All right. So that is the end of my Menti. Let me go back to the presentation. All right. Thank you for that. Thank you for participating. So I just want to remind everyone, I've said this a lot, but I think it's very important to remind people that well, I don't know why that didn't come up, but every dollar invested in public transportation generates $5 in economic activity. If people can't get to the grocery store, if people can't get to medical appointments, if people can't get to work, then that is money that is not being generated within our local economy. And so that's why transportation, I see it as one of the #1 things that we should be working on to make improvements. I think some of you who have heard the Lorain County Office on Aging Senior Needs Assessment, our county is at 25% of those who are 60 years of age and older. I also believe and have seen some information that we're losing our young people, and both our young people and our seniors are in need of transportation. So that's how important transportation is. That means quality of life is going to be as good without many options for people to get out because they end up living like prisoners in their own home. So I really want you to be thinking about transportation and anything that comes to mind, because at the end of this toward the end of this meeting, I'm really looking for your input regarding what we should be putting in our grant for 2023. So I'm hoping some of this information that we review will generate some ideas and some thoughts for you. I want to remind you, some of you have already seen this before, but I think it's important for us to go back and really take a look at some of the survey results from previously. When the coordinated plan was put together, which really laid the foundation for developing the Lorain County Mobility Management Program, we did a survey, which we almost had 700 people respond to. And the top 5 needs were access to grocery stores, access to medical appointments, access to the drugstore or pharmacies. Visiting family and friends have been coming in #4 consistently for the last 3 years, and then getting to department stores. In 2019, we worked with Kendall at Oberlin, and we primarily focused on senior centers, senior facilities, independent living centers, and asked the professionals what they believe the needs of their residents were. And you can see that it was very similar to what we saw from just the general public, which is they needed access to medical, but also that's when we first heard about the need for access outside of the county. And that's when I first began to realize that many of the medical needs for seniors many times exist in the Cleveland area, and it's not very affordable yet to have that access to Cleveland. But grocery stores, shopping, banking was #2. #3, pharmacy and religious events. #4, social outings and visiting friends and family. Once again, #4. And then to the Social Security office. So I think that that's just important to take a look at. 2020, those survey results were very similar and almost identical to 2018. So I want to tell you about some of the pilot projects that we have been working on that been very proud of, that have been successful here in Lorain County. One of them, I was very happy to work with the Office on Aging regarding working with some seniors who were in a building stuck. We wanted to do a small pilot thinking outside the box for how we create a transportation system by working with Lakota Way, because they have some federally funded vehicles to provide transportation so people could get to the grocery store. We eventually had to end that program, but it was very successful. I mean, and the reason why I say it was successful, we did that at a time when their families could no longer come and visit them because of COVID. And so they were kind of stuck there with not being able to get some of their needs met. But they were so appreciative of being able to get out. That's when it really dawned on me that part of the socialization also includes seniors just being able to go grocery shopping. And that is a challenge for low income and seniors here in Lorain County many times. I've been getting calls ever since we ended that pilot project for asking, when are we going to start that program up again? They loved it because yes, they may have some family and friends that can take them to the grocery store, but now they have to wait on their family and friends when they have time. And I had several people who call me and just say, do you know how lonely it is to sit here 365 days a year without going anywhere? And so that just breaks my heart. And so I'm really on a mission this year and into next year for how do we create that access for people to get to grocery stores? What can we do together? So I want you to really think about that. And if there's any ideas that you have, let's have a discussion about that. Next, I'm very, very excited to have been a part of, have a partnership with Lorain County Public Health and work with Lacataway, work with Kendall at Oberlin, work with Lorain County Transit to provide, and also even LMHA and Horizon Education Centers to provide transportation to 65 people to get vaccinated that would not have otherwise gotten vaccinated. We also worked with Life Care Ambulance Service who did the one-offs who weren't on loops as we move from community to community throughout Lorain County, encouraging people to get vaccinated. And I was at a lot of the clinics myself, making sure that people weren't getting stranded or helping to coordinate these services all around Lorain County. And what was beautiful about that is we began to start breaking down these silos and started working together in ways that we haven't really done before. And it really helped people. So what we're now seeing is now that we know that we can do this, it's time for us to add the technology in so that we can schedule these rides and help get people where they need to go. But that was really another successful endeavor. And then right now we are working on the workforce transportation pilot with Life Care using technology with a company called Share Mobility, focusing on people who live in Lorain and Elyria getting access to Avient and Togus in Avon Lake. And I appreciate both companies, but Togus really was the front runner in this with getting some of their employees that they currently have on board and testing the system, helping us work out the kinks, and really building up, they've been able to hire more people thanks to also Lorain County Urban League and El Centro that worked with us on some hiring events. I know at Lorain County Urban League, there were 30 people who showed up to that hiring event and about 13 or 14 of people walked away with job offers. And once again, this is a bunch of different people and organizations coming together. I also want to thank Ohio Means Jobs for their efforts too, to make this work. So it takes a lot of work, it takes a lot of collaboration, but I think with these pilots, it shows that we have to think outside the box in order to solve some of these issues. And it's really challenging because Lorain County is the 9th largest county of 88 in the state of Ohio. But we have probably out of all 88, the greatest transportation needs because we don't have the transit system like we did prior to 2008. And I'm not trying to blame anybody. It's just a fact that we don't. And so this is why we have to really be creative and think outside the box in order to resolve these issues. And it's more of a challenge even on the transportation provider side. Transit agencies across the country are suffering with shortages for workers, and, you know, the lack of being able to get new vehicles right now. So transportation, as much as it's needed, it's a challenge, but I think when we work together, we can make it happen. So I don't know if anybody has any questions regarding any of that, but I'm hoping it's getting your wheels turning and you're thinking about what it is that we can do here to resolve some of these transportation issues. But are there any questions so far? Okay, if not, you know, one of the, it seems like there was a slide that we missed. I want to go back to it, and here it is. Before we start talking about the transportation guide, because I want to show you the guide, explain to you some of the pieces that are missing in it that we've added, and get your input for whatever else that we might need to do to make improvements to that guide, because I'm in the midst of working on that now. But first, I want to go over what some of the goals are for the mobility management program. So first of all, in 2018, after we did the surveys, the 5 goals are to develop and implement a mobility management program. Second is to explore data collection and planning synergies, which I think we've done through a lot of the pilots, which is breaking down some of these silos so that we can work together. Third is coordinating educational training opportunities, and that comes in 2 forms. One is through helping people understand how to use transit or transportation services in Lorain County. For instance, a majority of people responded to the Menti saying that they have never been on Lorain County Transit. When I first went on it by myself, I will tell you it was very intimidating. I did not know what to do. I've been on Cleveland RTA several times, but not here in Lorain County. And so anybody who probably needs to use Lorain County Transit, if it's their first time, I know that they're going to feel like I felt. And so that's why most mobility managers across the state of Ohio, they're also travel trainers that help people understand how to use these various systems. We have been toying with the idea that many independent living centers or other organizations have drivers, and they may need some type of training. Sometimes these people have to go to Columbus to get this training, but why not perhaps have that training right here in Lorain County to make it more convenient for everyone? So that is something that we have been thinking about, but we haven't had a chance to really focus on, primarily because the pandemic kind of threw us into a tizzy where we had to really focus on some other things. But that is something that is on our radar, is to provide driver training here locally. Explore transportation pilot projects. That's probably one of my favorite things to do. As you can see, we've done quite a bit of that. But the number one thing that we really need to do is really to increase the awareness of transportation options here in Lorain County. And I want to see if I can bring up some data here that shows why this is the case. So I'm going to stop my screen again. I just want to show you some of this 211 data that I have seen recently. This is the one. Okay. So this is the 211 data that anybody has access to. If you go to Lorain 211, or is it 211lorain.org? Yeah, 211lorain.org. And I put this information in the newsletter every month about transportation and what some of the needs are. I tried to put in the last month's data, which is really about a month behind, right, Christine? Oh, a couple days behind. So I want to show you what the number one needs are regarding transportation. So if you take a look here, under transportation, public transportation, 35% of the transportation calls are public transportation. I find that and that means people are really trying or wanting to see more information on public transportation. And so that means we probably need to do a better job at really advertising that public transportation is available, the routes, the information, how they can access it. So I really like to take a look at this because I think in the past, medical transportation has been high. Actually, automobile assistance has really been pretty high. But for February, public transportation has been. Now, maybe that's also because it's cold and people don't want to walk. So there may be a lot of reasons behind that. But this, to me, is one of the reasons why we really need to really do as good of a job as we can at spreading the word, using like the transportation guide to get the message out there about what options are available. Now, mind you, it does not necessarily cover the rural areas. And so maybe that plays into this too. But that's the other reason why we really need to also look at how can we service the rural communities. So, and yeah, so if you look at where most of the information or the calls regarding, well, that's automobile. Let's see, let me get back over. So if you click on public transportation, on the map below, you can see where most of the calls for public transportation are coming from. And right now it's Oberlin, Lorraine in the 44052 area, and then Elyria, which is where public transportation actually exists, which is very interesting. But somehow people aren't getting that information. If you click on medical, it's mostly coming from the 44053 Lorraine, and then in Elyria, which once again, there's public transportation available in both of those locations. So this is just interesting information that anybody has access to. You go to 211lorraine.org, and at the top right corner, it says dashboard data or data dashboard, and you can look at all this data.
Hey, Sharon, I have
Yes.
a question and comment to make on what you had just said about public transportation, that it's interesting that the needs actually come from the area where we have it. I wonder, and this is just me throwing it out there, is if there aren't enough stops, B, there's not a lot of information, it's not easily accessible to find out where the stops are, and then maybe folks are just even having a challenge with getting to the stops. So I mean, obviously, I know we've been talking about expanding the stops and maybe honing in on better locations for stops, but I think that probably has a lot to do with it, and that's just my 2 cents. I mean, I know that my seniors would probably struggle with A, finding the information, and then B, getting to the stop to be able to get on the bus. So
that is correct, Lauren, because when I am out and about passing out the transportation guide, I get comments all the time. I see the bus, but I have no idea where it's going all the time. And that's the reason why we have been that's why I'm going to show you the packet of information that we're starting to provide with our transportation guide, and would love to, get your feedback on this. So I'm going to go back to my presentation if I can find it.
Hey, Sharon.
Yes.
To piggyback off of that, and I feel like we've discussed outreach and, really spreading the word, but maybe I've missed it. Have we not talked about signage, maybe improving signage, whether it's making it bigger or whether it's making it, you know, electronic. I know we've been talking about really incorporating technology, but I can say that when I pass down Cleveland Street, I see this little sign that says LCT, but I wish it were bigger. I wish we were more aware of that signage.
Yes, and Pam Novak is on the call today. And I think that this is all information that we can take into consideration. I know that there was hope, some of the signs that do exist, there was hope that we would reestablish some of these routes, and it hasn't been done. And I think one of the ways in which, there's a couple of ways in which we can really make some improvements. One is that if everybody had access to the transportation guide and shared it on their sites, you know, so the public would have access to that information, or somebody that has access to a computer had that, that would be great. We have hard copies. I know we give a lot out to the Office on Aging. I just recently gave some out to one of the veteran organizations so that they had them. You know, we can get those out to people. I'm at events in Elyria, Lorraine, and Oberlin trying to get the information out to people. That's the reason why we have the mobility management program, because there hasn't been any one place where people can access that information. And that's why the mobility management program exists, in order for that to happen. And yes, there are monthly meetings with Commissioner Lundy and with Pam Novak where we're talking about technology, because I think that that would be key. I know not everybody has access to technology, but I do believe that those who do could help those who don't have access with understanding those routes once we get that information together. So we are working on a GTFS feed where you will be able to look at the route schedule on Google. And I think with all of these things combined would really help. And I think it's also important to take a look at the funding that's coming down through the federal government to see what that could possibly help fund too. So that was a discussion that when we updated the coordinated plan last year, was really keeping an eye on the funding that could also assist us here in Lorraine County. So any other comments or thoughts? So go ahead, Natasha.
Sorry.
No, go ahead.
I just want to echo and emphasize what you said earlier about quality of life. Obviously, I'm biased in the field of economic development, but when you consider some of the projects that are coming down the pipeline in housing, you know, it's not just residential, it's also commercial. We need to consider that businesses trying to move into our community are evaluating things like that. So it is super important for this partnership for everybody to make sure that they're doing their part, because yes, the talent pool is important, but we also need to think about those that are in, you know, the millennial, pushing the millennial range, that are either single, married, or maybe a younger child. And then those people bring family members. I'm guilty. My mother-in-law has moved here. My brother's moving here. We're going to get my parents here. But my father is from New York City. He doesn't drive. So trying to think about the future and how I'm going to navigate juggling maybe having a child and making sure my father gets his doctor's appointments and making him feel comfortable to have the independence that he used to have. I really want to make sure that I'm echoing the quality of life aspect. And although people can sit there and say, oh, you know, transportation is not a problem here and people won't use it. Yes, it is a problem. Yes, people will use it, and we need to start thinking about the future and what that looks like for the people that are coming into the community, because Lorraine County continues to grow. Every year, the population goes up, and we're the 9th largest county in the state. So we need to be able to consider those, those results in data and the census, and also these big companies that are looking at our county saying, what do they have to offer?
Right. And so one way to really help with that quality of life, not saying that it's necessarily the cheapest, but for everyone to start sharing the transportation guide information. In my newsletter, also I have tips and social media posts that people can share for what are the tips for using these transportation services. There's anything from Lorain County Transit, Pegasus, CDC. We have a new transportation provider, Serenity Transportation. She's on the call today, right now. We've got, all these different options, because a lot of times people say here in Lorain County, we don't have any transportation. That's not true. I've been trying to get people to stop saying that because that's negative. We have it. We just need to improve it right now. So thank you for that. So let's look at this transportation guide. So this is a copy of the transportation guide. And what we have provided with it, because it wasn't part of it, and to make it easier for it to be read, is we have a senior and medical provider index, and I'm going to show you a copy of that. We have the local provider index. What it does is it tells you what page numbers these transportation providers are listed on, and then what times of the day, each day of the week, do they operate, just to make it easier for people to reference, so they can take a look at this index and then look at that provider that meets their needs, or providers, and then go to that page number in the book to find all their contact information. We have been including the Lorain County Transit maps. When we first had the book, we didn't have those included, but as I was starting to pass them out and people were starting to ask me about Lorain County Transit and where is it going, and I see the bus, I have no idea, we began to realize it would be very important to include that. And then there's also Medicaid transportation information. Sometimes maybe people don't realize that they have transportation benefits through their Medicaid program. This one doesn't include the extra 2 new Medicaid providers, including AmeriHealth, but it does have a contact number to say, hey, if you consider yourself low income and you're using one of these managed care providers, then here's the phone number that you can call to see if you have any of the benefits. And then there's a whole table that has been produced on what type of benefits for each provider of the 5 at the time. So I want to see if I can share this. So bear with me again, because I'm working with 2 screens. It's a little challenging.
Sharon,
yes.
if I could, while you're doing that, and just to kind of expand on the Medicaid transportation, many times if there is public transit available, the Medicaid plans will also allow for bus passes to possibly be utilized as well. And so really, you said it, they really need to reach out to their Medicaid providers, whomever it is, to find out exactly what transportation is available. We have our basic, all the plans have their basic, 30 round, 31 way, 15 round trip, whatever it is. I mean, it's just throwing some of the numbers out there, but there are other things, other pieces of the puzzle with that transportation with Medicaid providers. So they definitely want to reach out to learn more about what they actually have available to them. So,
yep,
for sure.
Thanks. Thank you, Mike. So this first screen that you're looking at is really showing the kind of index that I was telling you about that an intern actually last year put together for us, so that people can easily see which transportation provider in the transportation guide, what days. We have this both for senior and medical transportation, and then a separate one for local transportation that just supports anybody and everybody who wants it. For every day of the week. And I think on the weekends, it's one page because the weekend is basically the same times. So this is what we have provided so that people can easily identify what page to go to. And I'm going to be doing my best effort to try to incorporate this into the book so it's not a separate page, because this is like 6 pages each. So 3 pages each that I have to copy and fold. So there's that. Next, we have been putting in the Lorain County Transit schedules, which there are 5 different routes, 1, 2, 51, and 52, and 1 and 51 are basically the same route that goes from Lorain to Elyria, and 2 and 52, they both go to Lorain, Elyria, and then the downtown loop, which is almost, and Pam, you can tell me if I'm wrong, almost like a on-demand in a way. There is a loop, but that's a front and back of each of those. So that's 5 pages there, or 10 pages that are having to be folded, that we're putting into the book to provide that to people so that they do know where the bus goes to. And so that is probably one part that we won't be including in the book, because we're really hoping to see possibly some route changes. And as those change, we don't want to make those permanent and then get people confused. So I don't know if there's any comments on those first 2, and I'll take you through some of the other inserts. If not, so let me see if I can show you the data, which I thought was very interesting, or the actual transportation Medicaid information. I think it's sharing. So are you seeing the call? Okay. So this is the Managed Care Transportation Benefit Resource Guide, which I think is very helpful, that we have been including in the books as well. It is 3 pages long that gives the phone number and some of the transportation information. Now, this is going to be changing here. This is the plan. This is the grid from 2021 right now. So we will be seeing, I guess, 2 AmeriHealth and another provider that's going to be on this list. But this is what we're passing out. Mike, do you know if this list is updated yet?
I don't know if it's updated at this time, because yeah, you're right. There's going to be a lot of changes to this, because Paramount will be coming off because they were not awarded one of the contracts. So Paramount will be coming off for that. And then you'll add obviously us, and then Humana and Anthem. So there'll be 3 more that you would add, and then removing Paramount. So I don't believe it's updated at this time, because benefits are still being okayed and verified with ODM, the Ohio Department of Medicaid. So I know that right now, I would say it probably wouldn't be updated. The earliest would be till probably after July 1st, once the new contract kicks in, because benefits will be verified and okayed probably shortly up until that time, unfortunately.
Okay. All right. Let's see here if I can. So anyway, these are the sheets that we've been putting into the transportation guide. I don't know if anybody has any thoughts about what else maybe we should be including in the guide, we do have the travel tips in there. We have these sheets in there. We're trying to provide as much information. It might be a little bit overwhelming. That's why we put in the index to help people get to the information that they want to right away. But just any thoughts about the transportation guide, if you've taken a look at it, anything that we need to do besides maybe just incorporate a few of these things into the transportation guide itself. If there is nothing, and if you want some copies, we have a limited supply right now, but let me know, like we can get 10, 20 over to you. I'll get all these inserts in and can get them to you. And if you want the link, if you sign up for the e-newsletter that comes out every month, the link is right there. I would encourage you, if you're really serious about really wanting to help people, share that link on your websites. The more that we can share, the more we're going to help people. Okay. So now, participation time. So I'm really hoping that I wanted to share all this information with you. Whoops. I want to share all this information with you to hopefully generate some ideas and thoughts once I go through some of the goals that we've established for 2023. And this is based on the updates that we did at the end in December with a special group of people to help me update the coordinated plan. So, do you have any specific thoughts or inputs on this? Because we need to add narrative to each one of these goals. So our number one goal is to close the gap on unmet needs through awareness of transportation options by creating partnerships with grocery stores, other food resources, pharmacies, government agencies, healthcare, and area colleges. Now, we specifically put in area colleges because I remember reading, and I haven't had a chance to look into it too much, is that there is an opportunity through the new infrastructure bill for colleges to apply for funding to expand transit routes to focus on disadvantaged and low-income populations so that they can get back to school. So any comments specifically on this from your point of view? How important is this to you?
Sharon, can you hear me?
Yes.
Can we add industrial parks?
Yes, I guess it's not in there particularly. So
And
we can add it into the narrative.
okay, and based on just what you had with one of the local manufacturers, they help provide that transportation to get people in interviews and what have you. So I think it's key that we look at maybe making sure that we create some kind of routes associated with those industrial parks that may want to assist us, not us, but them as themselves, in creating some distinct routes to specific industrial parks that have the manufacturing and service industries.
Mm-hmm.
Okay.
Yep.
Sharon, maybe,
Yeah, go ahead, Mike.
I was going to say maybe to build off of what Jerry's suggestion is there, and not specifically for number one, but related to number three and exploring data collection. It might be beneficial to figure out how specifically to focus on the businesses in industrial parks to figure out amongst their current employee base how many individuals would be interested in utilizing public transportation. It's kind of similar to the process we used with Togus and Avient. Businesses may already have folks that are ready to ride, and it could kind of help drive where the routes might be considered for the existing transit. And then when the routes change, trying to specifically focus on targeting neighborhoods like we did for Togus and Avient within Elyria and Lorraine and other communities that have individuals that could benefit. You know, it kind of is, I guess, a more strategic approach. We always kind of assume, and I think if we get the businesses to be part of the process of gathering the input, that would be maybe addressing number 3 and 4, because you're talking about positive relationships with transit and work. So I'm assuming that's employers, but I think that kind of ties a few of these categories together.
Yes, and Mike, you are, that you must have been listening to the conversation Pamela and I had, Pam Novak and I had yesterday. She had a request can't come in from somebody who has a worker who is struggling with getting to work every day. Sometimes they have transportation, sometimes they don't. That's not going to be efficient for us to provide one-off transportation. We really need a concentrated effort with these companies to go, how many of your people are struggling? We need to do this as, they need to have a program in place because, you know, it costs $50 an hour. So for one person to be transported, that's a lot. And we're going to start getting all these one-offs all over the place. So we need to group these together. I mean, even if it's one employee at 5 employers that are close by, something like that. But you're right. We need to look at this more as a group instead of some of these one-offs, because I'm starting to get calls like crazy since the Avient and Togus with individual people who needs assistance.
Right.
And I totally agree with that approach. That's why I said industrial parks versus a specific industry or in the company. So absolutely.
And I was just going to add the interest from some of the key players that are in those same areas, but that's just one of the employment hubs of our community. And there's other employment hubs that we haven't even targeted yet. So we know, you know, there's the interest of the Cleveland Clinic,
Right.
and those are then allowing for folks in neighborhoods that may have never thought about applying for positions in those areas because they didn't have transportation to know that they do now have the ability to be employed somewhere where they could rely on public transportation if we have it in place, eventually saving possibly to buy their own vehicle and then not to necessarily need that resource anymore. But you got to start somewhere.
Yeah, and we also, and I know Natasha and I have been talking quite a bit with some of the employers, even in the southern part of the county, that are in need of transportation too. But we need to work on a program or almost like a package of what employers can do, because this is not going away, I don't think, anytime soon. Younger people are not wanting to drive as much. And they're trying to target neighborhoods where maybe it's a 1-car household. So I'm thinking we need to put probably some packages together for these employers. Any other comments on this? You know, two of our greatest needs besides work is starting to really be one of the ones that's surfacing to the top. But what about grocery stores, food resources, and medical? Any comments on that?
Well, I have to wonder what the feedback is right now from grocery store chains. You know, like if there is one giant Eagle that has a greater need, then okay, we can start there and see how that program works.
Every day I had to cross that thing.
Hold on. Hold on. Sorry about that.
When I worked residential and commercial.
Okay, go ahead, Natasha. Sorry.
No, that's okay. I'm wondering what's in place, and I'm sorry if that sounds naive, but I'm wondering what's currently in place, how it's being used. Is it that just that the advertisement of transportation is in these grocery stores, or do we have stops currently? Is that something that we work with assisted living or, senior facilities where, okay, on Monday, Tuesday, and Thursday, there is a route that goes to this location. And although it may not be every day, it's something that they know they could rely on. They know they don't have to call their daughter or ask their grandchild to please pick me up. Or even another thing, what about like, I don't know how this is possible, but also considering working with like Second Harvest or food
Right.
pantries, I feel as though those are certainly services that should be able to be accessible to senior citizens or low income that don't have transportation, but certainly do need to be able to eat. They can't even get to those food pantries.
Right. Right. I think that the one pilot we did with the apartment complex was great. I mean, and I think that there's something we can do in the short term, which is how do we get the food to people? But in the long term, the grocery store shopping for people who don't have transportation is a social event for them. It allows them to get out. They're not sitting, within the four walls 365 days a year. And so my question to people is, maybe we need to be considering both or all those options. And I believe in Akron, they have some type of wonderful food program that they operate through their transit system. And I think Lake County is doing something too. So those might be some examples if any of you are interested to take a look. But maybe I can try to bring some of those examples to everybody at the next meeting. So number 2, I think is obvious. Increased knowledge of available funding at federal, local, and state levels. We know that there's an increase to support transit here locally. And so the question is, what can we do? I've already mentioned a couple of them. I know that there's about a 30–40% increase to transit. How can we take advantage of that funding? I believe some of the funding might be able to be used. I know some of the CARES Act funding or ARPA funding was be able to use for workforce. And then also, how do we get people to Lorain County Community College, back to school, so that they can be ready to take on a lot of these job openings that exist. I don't know if anybody has any comment on number 2, but I think that that's probably a no-brainer. I mean, we're always looking for money for transportation. Number 3, explore data collection and planning synergies that allow community stakeholders access to information across system silos for true community-wide service planning. I think that we've shown that in examples through our pilot projects. What we need is more of that. So I don't know if there's any comments on number 3, other than what Mike Longo has already mentioned. And then we can go on to number 4, continue positive relationships with our local transit and work to create a user-friendly system. This was something that was mentioned at the through the coordinated planning committee. How do we create signage so that people are more aware of the transit? How do we add technology so it makes it more user-friendly? I think in the surveys that we've received so far for this year, a lot of people are saying that they really want to be able to use a credit card. Or so far, I haven't gotten that many. I think I've only gotten 14, but using a credit card or reloadable device to pay for their transit tickets is starting to really pop up. So the need is starting to show up. Now, I will say that it seems a majority of the people who have taken the survey so far are 30 to 35, but still we need to consider everybody, both the younger people and the seniors to make it more convenient for them. And I think that those are some ways in which we can do that. And then number 5, it's going to be time to rewrite the whole coordinated plan in 2023. Can't believe it's going to be 5 years already, but it is. So we'll be calling upon a lot of you for assistance and input, and You know, I'm really glad that the Lorraine County Office on Aging did their senior needs assessment, because that allows me to have some real recent data that we can use in that plan to update it. So I don't know if anybody has any other thoughts on these 5 goals of anything that we need to really consider as we put the grant together. Okay. If not, whoops. Want to, as I mentioned, the 2022 Lorraine County survey is out. I'm very happy to be partnering with the County Commissioner's office on this. It's really focused on how can we improve transit here in Lorraine County within the budget constraints that the county does have, taking a look at the routes, possibly looking and dusting off the 2017-2018 Lorraine County redevelopment plan, and looking at some of those routes and maybe seeing what we can do with that. So we need everyone's help. If you are interested, I know that in the last newsletter, you could have downloaded this and posted it. You can contact me and I can get it over to you. But if you could send this out to as many people, or if you have connections with people who need and rely on transportation, we have paper copies too. Let me know. I can get you paper copies. I can send you this ad. We just want to get it out there. We're taking input through July 1st. I will have an update. At our June 16th meeting with where we are so far. So let me know about that. Also, I have a small group going with me on Lorraine County Transit on April 1st, but for everybody else, the month of May, if you've never been on Lorraine County Transit, I think it's an experience you all need to have, to understand what it's like for those who have to rely on transit, what their experience is like. So you can book time with me in May, and we will ride together. And then I want to also point your attention that if you are really passionate about transportation here in Lorraine County, there is an advocacy group called Move Lorraine County. They are looking for board members. If you're interested, you can contact Ryan Aroni or myself, and we can get you, I can get you connected to Ryan or any one of the other board members so that you can join. They are going to be having an annual, right now it's tentative, an annual meeting on May 19th. It's going to be a luncheon, probably between 11 and 1:30 or 2. We're considering, and Pamela doesn't know this yet, we're considering maybe asking some of the businesses to be transported using the trolley. You know, they can book an appointment and then we'll go pick them up and take them, because they're Move Lorraine County. So why not use mass transit to get to this event? So we'll keep you posted on that. We want to update you on the pilot project. We want to update you on the Paradox Prize, which is how do you get to work? We're looking at bringing in Ben Chappelle, who's the CEO from Lake Tran, which is a county very similar geographically to Lorraine County, to talk about what they're doing over there. So just mark your calendars for that, save the date. Hope you can attend. And then here's a couple of things you can do too. Like Lorraine County Mobility Management on Twitter and Facebook. You can promote Move Lorraine County site. You can sign up for the e-newsletter that comes out every month to keep up to date on what's happening. And then you can also donate, because we need 20% of local funds to support the work to improve transportation options here in Lorraine County. So with that being said, we have 5 minutes till 11. We can let you go, but wanted to see if there's any other comments or questions that any of you have.
Sharon, thanks again for all the hard work.
You're welcome. You're welcome.
Absolutely. I
Appreciate it.
thank you.
So if there is nothing else, here's my contact information. You are free to go. I appreciate it. Our next meeting is going to be Thursday, June 16th from 9:30 to 11. All our meetings are going to be hybrid, so you can either join via Zoom or in person. But thank you for your attendance and your comments today. Really appreciate it. Have a nice day.